My name is Abdel Hakim Moustafa. I'm a cardiologist and I did my specialization in advanced cardiac imaging at Hospital de Sant Pau Santa Creu Barcelona, which is one of the oldest hospitals here in Spain and is a tertiary hospital. And our main focus is cardiovascular disease. On daily basis, we encounter very complex patients within our cardiac imaging unit. And some of them have congenital heart disease. They are very unique and particular patients who, since they were born, have suffered different type of surgeries. And at some point, we need to do heart transplant. So we had a patient with such a disease that it needed very careful planning that on the usual 2D scans is actually impossible to go through. Not only as a cardiac imager, but also to be able to explain this to the surgeons and the staff before going to the surgery. Patients who goes to heart transplant with congenital heart disease, sometimes that usually they go into a waiting list until a heart appears, so we can do the heart transplant. So it's very important to have the 3D model physically or virtually ready for the day of the surgery, because those type of surgery, you don't plan them. It just happens. They can call it from one day into another to go through with it. And in this particular case, it was very important to have the planning ready, and with all the team already know how the plan before going into surgery, it makes you much more prepared till this day. Having a 3D physical or virtual model help us from the beginning to bring the best care for our patient, since you have to explain that surgery for him or for her. We can get the best consent before surgery, and also going to a surgery beforehand with all the planning, and also being able to take the model with you to the theater reduce a lot the time of the surgery, and in this case reduce the time of having the transplanted heart in less ischemia time. This on long term will bring benefit and more healthy heart. The greatest benefit of using 3D modeling is the ability of translating the 2D image in 3D image, but also be able to share it and also do advanced measurement and planning, and also be able to obtain from it a physical model. The three words I would use to describe Axia 3D are innovative, because they have one of the best cloud-based AI-enabled segmentation tool, because segmentation is the bottleneck of 3D modeling. Accessible, we do a lot of 3D modeling in-house, but sometimes you don't have the time or the capacity to do it for the next day, and you can count on Axia to do that. And efficient, they are really fast, and the communication with the engineer was really perfect for this case.